We're standing 6 feet away, so I can talk to you without a mask. Hi, I'm Dr. Jen from Family Pet Veterinary Center and Animal Dentistry Referral Services, and we're here to talk about cat dentistry, specifically cat anesthesia with veterinary dentistry. And Natalie is my assistant. She's going to be asking some questions that have been come together, and I'll see if I can answer them for you.
Dr. Jen, why does my cat need anesthesia for teeth cleaning?
Well, I mentioned in another space that under anesthesia, we can actually do imaging. So we can't do intraoral x-rays or 3D imaging without anesthesia. And imaging looks at 2/3 of the tooth that is below the gum line that you can't see when they're awake. And 80% of the cats have problems when you look at that stat. If you don't look underneath the gum line, you'll be missing 2/3 of each tooth and potentially missing, well, pretty much usually commonly missing problems.
Are there ever a circumstance when a cat can get their teeth cleaned without anesthesia?
It's been tried and done, but it's actually cleaning the stuff off the top, like what I can touch, but it's not working in the gingival sulcus. The gingival sulcus is the space between the gum and the tooth. And if you go in there when they're awake, you're going to damage the soft tissues of the mouth and cause a lot of bleeding and pain, and you'll miss problems. And so if you clean the teeth and make them look prettier awake, you're still missing things and leaving the pet with an 80% chance of having a painful mouth still present and potentially make things worse.
Why are antibiotics and pain medications sometimes prescribed for my cat's dental?
So we want to make sure every pet has a fear-free and pain-free experience. So we try to utilize calming techniques in the office and minimize the fear, anxiety, and stress they may go through. And we do a pretty good job of that. We're surprised a lot of cats, I don't have the feeling in this room here to show you, but that is one of the many techniques that we use. And when we see painful problems, we don't want to wait until it gets bad. We want to address it. If we know there's a painful problem, we like to use pain management before, during, and after the procedure. And a lot of times we use nerve blocks, and the nerve blocks that I like to use can, the numbness will go away, but the analgesia, the pain relieving component, will last 24 to 96 hours without you having to do anything at home. And so when we need antibiotics, when we need pain meds, we're going to use them, and not every patient needs those.
How do I know if my cat will have a reaction to anesthesia?
What you're really asking is about anesthetic safety. And while no pet is without risk with anesthesia, the risks of having problems and painful hidden problems in the mouth is very high. While the risks of anesthesia is about 0.0 or 0.1%. It's very, very low. And we try to do everything we can to prevent problems by doing blood work so we can choose and tailor the anesthetic drugs to them, by doing special heart enzyme tests. We had a patient with a special murmur that we caught with this special little stethoscope, and we were able to modify our anesthetic plan and have increased safety and a good recovery. And so we do things to make it as safe as possible. It's actually been shown that a cat that has either no anesthesia and physical restraint, or a cat that has sedation but not anesthesia, has a higher risk of problems and or death with those items than with a patient that has a full, what's called multimodal pain management anesthetic event. And so we really make it easier for the pet and better outcome. Thanks for joining us. That sounds like all the questions Natalie has for us. If you have further questions, send us a note and we'll be happy to give you more answers. Thanks.